Hello, I'm Dr. John Rex, and I'm here to answer your burning questions about AMR. AMR, antimicrobial resistance, is the big term that we use to encompass all of the possible ways that the bacteria, viruses, fungi, parasites in our world can become resistant to the antimicrobial that we use for them. And the truth is that all these living organisms, they're not interested in being killed by our antimicrobial agents. And so as you use antimicrobials on them, they figure out ways to escape. So the phrase antimicrobial resistance broadly means resistance to anything. Having said that, there are some sort of nuances in that. We sometimes use the phrase antimicrobial resistance to refer more to antibacterials. Not entirely logical, but you will sometimes see the phrase AMR, and it's really about antibacterial resistance. And you kind of have to read between the lines to figure out which one it is, but collectively it's all about resistance of all of the other living things to the things that we want to use to kill them. Anybody, even a healthy person, can by accident have an infection. You can have a urinary tract infection, you could cut yourself and get a skin infection. In either case, you've got an infection with some strain of bacteria, and increasingly these days, it's possible that strain of bacteria will be resistant to our first or maybe our second or even our third line of drugs. Pretty good, a typical example these days would be urinary tract infections. You can be a lady who gets just a plain old ordinary urinary tract infection. You expect to go see your doc and get a pill for a few days. It's going to make it go away. And the pill doesn't work, and the second pill doesn't work, and the doc says, oh my, actually I need to give you something IV for a couple of days to treat your plain ordinary urinary tract infection. It can happen. It does happen reasonably regularly. So that's how it's out there. It's important to realize that resistance is something that's outside of you. You don't become resistant to the antibiotic. It's your bacteria. And the resistant bacteria are circulating everywhere, and any one of us can pick them up. And then if you happen to have an infection with it, you're in trouble. It would be possible to have a MRSA, a MRSA infection that required a very high-end antibiotic for therapy. Fortunately, we have pretty good drugs for MRSA, but you would need the pretty good drug, not the plain old ordinary drug. And that's the key. Antimicrobial resistance can affect any of us at any time. Like, comment, and subscribe for more. Thanks for watching.